We turn now to Christchurch and acute inpatient mental health care. Tonight, Checkpoint can reveal that the system is so stretched that even the Associate Health Minister describes one facility as not ideal, saying, and I quote, "We would rather have the residents there in other better suited accommodation." The facility is the Seeger Clinic. It's part of the city's Princess Margaret Hospital, but in an email sent by the Associate Health Minister and Christchurch Central MP to a family member of an inpatient receiving care for paranoid schizophrenia, Nicky Wagner states the hospital would have been closed by now were it not for the earthquakes, that it's due to be decommissioned, and I quote, "The whole of Canterbury's medical system is under stress at the moment as we rebuild." Nicky Wagner declined to be interviewed about her comments, but her email was in reply to a complaint from Marcel Lunam, whose 51-year-old brother was in the Seeger Clinic.
And when we went to visit him, I was really shocked at the state of the building. Essentially, it was really dark, it was filthy, it was completely squalid. The building was like cracked, surfaces cracked, ceiling was crumbling. It looked like it had had some kind of quake damage. I'm not certain of that, but it looked like that. I mean, it was in an advanced state of disrepair. The kitchen was completely unhygienic and slovenly. It had a parquet floor that was ripped up in places, obviously completely worn, with the old floor showing underneath, and it, just a hotbed of, germs, you would imagine, festering away there. There was food slops on the floor that hadn't been cleaned of the dining room. As I said, it was predominantly dark, and I don't know whether or not they'd elected to keep the electricity off or whatever in parts of the building, but predominantly dark. And in these rooms that are locked, and my brother's an acute paranoid schizophrenic, and he was in this one room, is completely desolate. This is a shocking place to put this very vulnerable person who's suffering acute psychosis and imagining these terrifying thoughts, people out to kill him or that he's evil. And he's in this situation of this room that has no window, no air conditioning, crumbling ceiling, and cracks in the walls. I mean, it would give anybody nightmares, let alone someone having a psychotic episode.
Marcel Lunam described the conditions to Nicky Wagner, who agreed it was not ideal and said they would rather have the residents elsewhere, but there was nowhere else to take him, and the family made the decision to pull the man out. They were given drugs by clinic staff and told to administer them at home. But while his 75-year-old mother slept, Marcel's brother had another psychotic episode and snuck out of the house.
And he couldn't be found, and so keep in mind he's diabetic, he's on 30 pills a day of these, incredibly strong meds. If he doesn't eat, he's sick. If he doesn't have his medication, he's sick. Plus, he's having a psychotic episode. So we had to do a missing persons report on him because he didn't come back all night. It was pouring with rain that night. He had been down in a park by himself under a tree, believing that he was, that somebody was after him. They were going to kill him.
Trapped between an inpatient facility the Associate Minister described as not ideal and attempting to care for Marcel's brother at home, the family have contacted Nicky Wagner, desperate to get an alternative to the Seeger Clinic and also to advocate for an alternative to the Seeger Clinic in Christchurch. Nicky Wagner replied, "The issue is how much work should you do on a building that is due to be decommissioned?" And she stated the whole of Canterbury's medical system is under stress. She apologised and, I quote, said, "Sorry, not a very satisfactory answer for the immediate term." Marcel Lunam says that's simply not good enough.
And my question to the ministers that are stymieing a progress for a mental health facility that's so needed here would be, would you stay there overnight? Would you live in this place? Would you put your relative here? That would be my question to them, to the David Meatses and the Tony Gutschlags and to Nicky and to all these other people that are sitting there and they, on a taxpayer coin, and they should be accountable. They should be accountable for this, because mental health is an issue for so many of us. It's a really common problem, and I'm not saying acute psychotic disorder is, or paranoid schizophrenia is hugely common, but mental health is a big issue, particularly in Canterbury, when they knew in Canterbury that there was going to be an increased demand for mental health services due to the quake. They knew this, and there has been no concession made. And I'm furious about it. It's not good enough. It's not okay.
Marcel Lunam. Nicky Wagner declined our invitation to be interviewed. Tony Gushlag is the Canterbury DHB's General Manager for Mental Health Services. She would be interviewed. She says she doesn't know how long they'll keep using Seeger House or where mental health patients will go in the future.
We've got a range of health services and inpatient services on the Princess Margaret site, and it's fair to say that we're not happy with them. They're not ideal in terms of providing health services, but we're really trying to make the best of it at the moment, and the plan is to have a new facility, so we're just working through that process.
And when will you have the new facility?
I'm not sure. So we're working through the business case process. There's a...
sorry, forgive me, what's the business case process?
So there's a process that DHBs need to go through and work with the Ministry on how we secure funding support for
Okay, so you're saying it's not ideal. That's precisely the same phrase the Minister or Associate Minister's using, not ideal. And I guess it's not a coincidence that you're both using that phrase, but you still have to go through a business case pitch to the Ministry to replace a building that, by everyone's admission, would have been gone by now were it not for the earthquakes, has been decommissioned, has no future, and is not ideal.
That probably sums it up, John. Yeah, there's a range of services on that site, and we don't have an immediate solution, and we really would like to be delivering or providing those services in a more contemporary environment. It would be better for patients, it would be better for their families, and it would be better for our staff.
This is a nightmare scenario for you, really, isn't it? Because I can tell by listening to your voice that actually you're not at all happy about the situation. And I can tell from reading the emails that everybody wishes the patients weren't being treated here.
That's correct, yep.
And so something has to happen, doesn't it? Because if we look for vulnerable people in our community, setting aside the very young and the very old, there aren't many more vulnerable people than people who are suffering from this degree of mental health illness.
I think there's all sorts of vulnerabilities, but in terms of people who need to use mental health services in Canterbury, we do. We've had particular challenges post-quake, and you'll be very aware of those, John, and many of your listeners will. But this is still uncharted water in a lot of ways. We've had huge
but boy, gosh, look, absolutely, and no one's blaming you for the earthquakes, and no one is blaming you for the fact that Princess Margaret is an elderly facility that was due to be decommissioned. Full stop. But I guess we're talking about uncharted waters that have been around. The earthquakes were 2011. There's been a lot of time to charter the waters, hasn't there?
Yeah, but partly we're needing to use those Princess Margaret facilities in different ways than we did back prior to the earthquakes, because we have run out of capacity in our acute inpatient unit on the Hillmorton site. So, there's kind of this cascade effect as you start to get more and more people needing to use the
Absolutely, and there have been previous discussions, about the impact of the earthquakes and the aftershocks and life in post-quake Christchurch on mental health. So what you are describing is a situation where there are insufficient beds, where you have an elderly and inadequate hospital trying desperately to do work that it is simply no longer fit for. Would you like now to pitch to the Minister and the Associate Minister, who is after all a Cantabrian, for more support, more beds, more money?
Of course, we would really like some support to get the business case process sorted. We need to have certainty, I think, in terms of time frame. So how long is it that we are going to be on the site for, so that we can make the best of the existing facility, we can make decisions about painting or decorating, and we can provide certainty to patients and their families.
I don't want to put words in your mouth, but I can't remember the last time I did an interview with someone who so manifestly sounded like they were stuck between a rock and a hard place. What's your title?
I'm the General Manager of Mental Health in Canterbury.
Right. And clearly, if you're the General Manager of Mental Health, you give a damn about mental health, right?
I absolutely do.
Okay. And on the other side, you seem to have an issue about securing the money, and you seem to still make a business case for something that actually is patently obvious, needs to be supported. And so this is a nightmare scenario, really, isn't it? Not only for you, but for everyone working with you and under you.
Yeah, that's right. And we've had really great support from the from the District Health Board. We have originally the plan was for the mental health services to be sitting in Christchurch Hospital. That was part of the original business case with that facility, but then that changed and we needed to go down a different pathway, so we're still working through that. So I understand that the business case from our DHB is going to the Ministry of Health Capital Investment Committee in February, so just a few weeks away, and we're really looking forward to hearing about the outcomes of that.
So the business case, so all going well, you're going to have an answer sometime after February?
I hope so, yeah.
And in the meantime, are your patients, are people like the man we have been talking about today, a paranoid schizophrenic who suffers from psychotic episodes, being cared for as well as you would hope?
Look, our staff do an amazing job in really difficult circumstances, and it's not always perfect, but I know people try really hard, and when we get feedback from families and patients that things aren't as they would like them to be, we really take notice of that and we make changes as we need to.
Tony Gooselak from the Canterbury DHB, who would front and did front, as you hear. The Christchurch Central MP and Associate Health Minister Nicky Wagner declined the invitation to be interviewed.